Hi, welcome to Rotemberg Plastic Surgery. I'm Dr. Baotram Tran.
I'm Dr. Silvia Rotemberg.
Alright, so we're going to talk to you about a BBL, which is a Brazilian butt lift.
And we do have a lot of patients that come in for a Brazilian butt lift. And basically what it is we do liposuction in all your excess fat areas. And we inject that fat. After we clean the fat, we inject it in the butt to give you more volume.
Right. I think it's very important this is one of those procedures that can be very dangerous if it's not done properly. So I think it's very important to do research on your surgeon, make sure that they are board certified so that they know, very well aware of the anatomy to know where the proper place is to do the fat, to place the fat.
Yes, we try to place the fat just under the skin.
Right.
Not into the muscle, because if we place the fat into the muscle, there's a higher chance for you to have fat embolism, and you can actually die from it.
Right.
So it can be a dangerous procedure. So you should choose carefully who your surgeon is going to be.
Right. With the proper placement of the fat in the subcutaneous layer or the fat layer and not into the muscle, the procedure is very well tolerated and the patient doing very well and is very happy with the result.
And we try to contour that butt. You have to understand that about 50% of that fat will be reabsorbed.
Right.
And sometimes for some women that they want to have a very large butt, we have to do it again.
Right. Yeah, exactly. Because whatever we are able to place in at the surgery, like Dr. Rodman mentioned, about 50% of that will get reabsorbed by your body. So if you want a much larger volume, it needs to be redo again to give you the proper volume that you would want.
Right. The liposuction, especially on the back here, will automatically accentuate your butt. So we'll make your butt stick out a little bit more, even without the fat transfer.
Yeah.
So when we do the extra fat transfer, that helps give you the shape and size that you're looking for.
Yeah, I think that the female silhouette looks a lot better once that extra fat is removed, and then it looks like your waist is get smaller as well. Mm-hmm. from the surgery.
Right.
I think post-operatively would be the big thing for BBL, right?
Right. Post-operatively, I think you will have a lot of pain around that area here from where the liposuction was done. The butt itself doesn't hurt too much.
No.
We have patients sit on a pillow for about 3 months. And if you can go to work, but you just have to remember you can't sit on a hard chair. You have to sit on a soft pillow. And I usually tell them to sit on a soft pillow for about 6-8 weeks, just to help maintain that fat.
Right, because you don't want too much pressure on the fat, then the fat won't lift. You basically decrease the blood flow to the fat if you put too much pressure on it. So that's why it's not as good to sit on, optimal basically to sit on a hard surface. And then area where we have done the liposuction, we would recommend lymphatic massage, just like regular liposuction, to give you the optimal result and the best contour.
Right, and you will have to wear a girdle for about 6 weeks after surgery. They may require more if they need to be.
If they want to be bigger.
Bigger.
Right. But overall, I think most people just do it once and they're pretty happy with their volume, because it makes such a big difference with the contour, right?
Huge difference with the contour. We give them a nice waist and a nice rounded butt.
Right. Just restriction-wise, nothing significant. Just no heavy lifting for about 2 weeks because of the liposuction.
Yeah, you won't be able to. You're gonna be a little sore, so it's gonna be hard. But then if you can start the lymphatic massage as soon as possible, the next day after surgery, that's great. It will make a big difference in your recovery.
Absolutely. Any other questions? Feel free to contact us by email or call our office.